Let me first of all welcome everyone to this dialogue, third dialogue in the series of part of the Roadmap to 2030 consultation and co-creation process with our partners. This dialogue is co-hosted by the G20 G7 Health and Development Partnership, AHEN, UNICEF, and the OECD. We're very privileged to have their expert engagement and support in building out this particular dialogue. I'm going to start by talking a little bit about the agenda and some of the house rules for this particular event. So we will start off by setting the scene, framing a little bit what this initiative is about, where it comes from, and what we want to try and get out of it. We will then ask your opinions on some of these big ideas and themes that we've been working on. We will then invite some reflections by our co-hosts, and we will follow this by a group meeting and engagement exercise where we will invite all of you to contribute to some of the thinking around the main themes, the ambitions, and the key actions that we want to take in this particular on this particular theme to build out the roadmap to 2030 that we will then be launching on the 12th of December. Now, for this particular event, we would like to invite you to introduce yourselves in the chat so that we know who you are. So please make use of the chat function. Tell us who you are and where you're from so that we can get a sense of who's on the call. Please also use the chat if you have any questions or suggestions throughout the dialogue. We want to try and make it as interactive as possible in the sense that we want it to be a dialogue. We don't want it to be a one-way thing. And we would like to invite you to make use of this chat so we can gather your thoughts, inputs, comments. If you want to make a comment during any of the breakout sessions, please put your hand up and we will unmute you and invite you to share your thoughts and reflections. You can do that by using the icon in the bar ahead. Please make as many comments as you like on the Miro board that we'll be opening up as a space for collective reflection and consultation. You don't need to only make one comment. Please make as many as you like. And again, make as many comments in the chats. We will take and capture those comments and ensure that they are reflected in the roadmap that we're building out through this specific process. I'd like to introduce you to our co-host today for this particular dialogue. Alison Raw from the G20 G7 Health Development Partnership. Welcome, Alison.
Thank you.
Jai Ganesh from the AHEN Asia eHealth Information Network. Welcome, Jai, for joining us from the Philippines at the moment. We have Brendan Kweziga from UNICEF, currently located in Nairobi, Kenya. Hi, Brendan.
Hi. Thanks, Frank.
And we have Rishub Kilara from the OECD, usually based in Paris, they're currently sitting in London.
Thanks, Frank. Happy to be here.
Lovely, thanks. Well, welcome to all of you, and thank you so much for your leadership on this particular initiative. Looking forward to hearing your thoughts as we progress with through the agenda. Now, I wanted to start to give you a little context on what the roadmap to 2030 is, what we aim to achieve, what are our objectives, and how we would like to work with you on this going forward. We hope that this would be our first point of contact, or if we haven't already engaged with you, some of you have been engaged before on this. And invite you into this process with us. So the roadmap aims to chart our collective journey to the Sustainable Development Goals date of 2030. We want to build consensus around key priority areas and milestones that we should focus on as a community to accelerate the digital transformation of health in order to progress universal health coverage. The objectives are to build sustainable momentum. So it's a program of action that we want to drive forward. It's a roadmap that has clear, if you like, milestones along the route in order for us to work together collaboratively and with governments and others to create an enabling environment for the digital transformation of health systems to happen in an accelerated manner and towards UHC. Importantly, we want to focus on the enabling environment, not so much the technology. A lot of people are doing some fantastic work on that, notably some people on this call, no doubt. But we want to try and elevate this a little bit to see to try and identify what the enabling environment challenges and drivers are to ensure that that technology can be adopted in a sustainable manner at scale and deliver on the impacts that we know through the various pilots that have taken place over the years that can achieve. So the roadmap will set out what needs to change, who needs to act, and how we can work together to achieve the impact. And we want to create this with government, civil society, youth networks, and as many stakeholders as possible. Now, this particular initiative is meant to complement other very strong initiatives within this sector, namely the global digital health, the WHO's global digital health strategy that has been extended to 2027, and we want to also support the creation of the new one that's going to be developed in the coming years. The UHC Agenda for Action, the UHC 2030 strategic priorities, and the implementation of the Global Compact, and also regional initiatives. So we see this as an enabler and a contributor to what's happening in the wider sector in order to try and achieve concrete action together to try and address the enabling environment. Now, where did we come up with the themes that we will be unpacking during this particular dialogue and the other dialogues that have taken place during Digital Health Week? Well, we developed a piece of analysis called Framing the Future, the current state of digital transformation of health and the road to universal health coverage. An in-depth analysis of the current situation in relation to digital health and the trends leading into 2030. And what we found out is that impact is not determined by technology alone, but by politics. We've seen 25 years or more of digital technology being piloted very successfully, but failing to scale, failing to be adopted in a sustainable manner. We've seen a lot of fragmentation and siloed approaches. That is not the fault of the technology, which has proven very successful, but a failure of politics, a failure of political imagination to take this technology and to really lead its adoption and implementation at scale, providing it with the right enabling environment in relation to laws, regulation, policies, funding, and coordination mechanisms and leadership necessary for that to succeed. Government leadership and ownership is critical for change to happen in a sustainable manner. And we found that this has not always been the case, and we will see that a lot of the donor funding has maybe obscured that some of the voids and gaps in terms of government national leadership and technical capacity to drive initiatives forward. And it's only at the end of particular projects and initiatives that has become apparent. Coordination and national alignment is necessary to make progress, again, to ensure that there isn't fragmentation, but there is coordination, consistency, and coherence driving initiatives forward. Transformation needs to be rights-based, equitable, and inclusive so that everyone benefits and no one is left behind. Assuming that agnostic technology can be adopted in a context where there are differential power relations and somehow resolve those power relations is maybe a little naive. We need to recognize that the technology will only reinforce unless we deliberately try and ensure that it reduces inequities. It will only reinforce what's already there. And this can only happen by strengthening the enabling environment, policies, legislation, regulation, funding, budgets, and resource allocations, and coordination, and mechanisms and political leadership. Now, the series of dialogues that we are organizing during Digital Health Week are going through a set of are addressing a specific theme each day. Equity and inclusion on Monday with people at the center. We looked at national policies, legislation, and regulation yesterday. Today, we're looking at resource and investment, a very important discussion that lies at the heart of many of the other themes. Tomorrow, we will be exploring the issue of national leadership, management, and coordination. And finally, on Friday, we will be looking at standards, infrastructure standards, and interoperability. With different co-hosts leading these discussions with us. I would invite you to please look at the Digital Health Week website and sign up for any of these initiatives if you are interested in taking part. Now, a little bit about the roadmap and how we're developing this. We're developing it in two phases. The current phase is a process of consultation. This dialogue forms part of that, where we will invite participants to share their thoughts and inputs. We will take these reflections and comments and develop a more detailed version of the roadmap that includes all the themes and how maybe they work together. We will then next week put this draft out for a broader public consultation and validation process that will close on the 5th of December. The results will then be consolidated into a final draft that will be launched on the 12th of December. So we would invite you to take an active part in please helping us create this. And if you feel you want to have a further crack at the nut, if you like, there will be an opportunity to participate in the public consultation and to also promote this through your networks. Now, I wanted to talk a little bit about the findings of the report of the analysis that we conducted from the perspective of this particular thematic issue, which is resourcing and investment. What we found through our analysis was that, in terms of the situation as it was at the time of analysis, most financing remains fragmented, short-term and project-based, which limits sustainability and national ownership. The funding cycles for projects are 3 to 5 years, and then after that, there isn't a clear transition forward and what have you. There needs to be a wholesale shift towards predictable, transparent, and aligned financing. And this is a discussion that has been with us since 2005 with the Paris agreements and the Accra Agenda for Action. This is not a new issue, but it's very present within the digital health field. So this includes investments in essential and often overlooked foundations that make digital transformation possible, the brass tacks, if you like, of health systems: reliable electricity, infrastructure, maintenance, connectivity, administrative capacity. Those, if you like, often neglected backbones that need to be resourced and constantly in order for the grease, if you like, the oil that maintains the machinery going. Those things are often not adequately financed, or they're financed in a low level as part of a project sort of project funding, but then neglected and dropped. Evidence shows that up to 3/4 of total investment needed in digital health in low and middle income countries lies in these foundational costs, things like records, infrastructure, power, ICT equipment, data storage and maintenance, not in new applications and pilots. Those are the recurrent funds that are needed. These elements are often excluded from donor and partner funding frameworks, and they're necessary over the long term. And addressing this imbalance is going to be key to avoiding the cycle of fragmentation, short-term initiatives, and instead enabling coherent and sustainable transformation. So that's necessary. Now I'm going to go through two maps now. that show a little bit what we were hit with at the beginning of the year, which, let's be honest, this had a massive impact on all of our lives, working in digital health, international development, and humanitarian work and others. This picture, so I won't dwell on it, but just a reminder. I want to also highlight the fact that this picture, if you like, the impact of funding has also mirrors the impact on the countries that are most behind in achieving universal health coverage. So the countries that have suffered the greatest reduction in funding are also the countries that are most behind in terms of achieving their universal health coverage goals. So that is a picture, that is a new reality. We've all got our opinions and we've all been complaining about it, I'm sure, for the last few months. But that won't stop, at least until 2029, when there's a new set of administrations coming into many of the largest donor countries. I'm talking about the UK, France, Germany, the US. These are new administrations that are confronted with new realities and different priorities in relation to the funding, and that's impacting our sector. So with less funding available, low and middle income country governments are reassessing how they use limited resources in more cost-effective ways to deliver essential healthcare services. The risk for our sector is that a lot of governments pivot towards, basic services and vaccinations in order to cover basic health needs, and drop the digitalization process, the digital transformation process. That would be an error over the long term for reasons we all know. The optimization and efficiencies that you can create through digital transformation, make this a very good bang for your buck, if you like. During our research, interviewees believed that the funding shift will move power from donors to more country and regional led approaches. So there's a shift in the power dynamics across the sector, and opening space for private sector and national civil society to play a stronger role. This may slow progress in terms of digital transformation, but that progress will be locally owned and more sustainable over the long term. That was a feeling that came out quite strongly in the interviews we conducted with key informants during the course of our analysis. The gap left by traditional donors is currently being covered by other countries. China committed 50 billion. Saudi Arabia is filling this gap. UAE is filling this gap. Turkey, I believe, as well. Philanthropic organizations like Gates committed 200 billion, from now to 2045. So others are filling the gap, but that gap is not likely to cover what was taken off the table. So governments are going to have to find new mechanisms, loans from the World Bank and other regional banks. These are often accompanied by technical support and advice, and create new partnerships, but also create greater country ownership and accountability. Because when taking a loan out, those loans have to be repaid by the country, and receiving donor funding is a different proposition than having to take a loan out that your citizens are going to have to repay. So accountability goes down rather than up, and that opens space for greater participation and ownership, not only at the national level, but also a greater role for civil society and other actors in this space. Additional sources of financing include the International Monetary Fund's Resilience and Sustainability Trust that has $650 billion in financing available in low and middle income countries, and innovative financing mechanisms such as debt for health swaps. Basically, there is no that will be considered. The role of the government as service provider may have to change as well. As funding is off the table, we may see that the government fulfills more of a role of managing resources and setting standards, enabling others to provide the services, given the fact that it is unable to pay for that themselves. So there may be a shift in role within this broader ecosystem. What is coming out strongly is there's no single solution to health financing challenges beyond increasing domestic investment. Ultimately, achieving UHC cannot depend on external funding in the long term. And this is something that has to be recognized. Many governments are recognizing this and looking for ways to bolster that domestic funding. Continuous investment and national governments need to own their commitments and resource them adequately. And there is a precedent in this regionally. Latin America at the end of the 90s and going into the 2000s saw a massive drop in donor funding. Many donors reprioritized and decided not to fund Latin America. They were coming out of periods of civil war and autocracy that ended in the late 80s, early 90s, and by the late 90s, there was a massive drop in donor funding, and many Latin American countries that were receiving donor funding or whose health sector and other sectors were donor dependent in many ways, found that they had to reprioritize, take out loans, and have conditionality set on them, and also and find domestic ways to resource this. So there are potential learnings that can be gleaned from different regions. Now, I'll just finish this section, and thanks for your patience. I am talking quite a lot, but I want to show you this next section on what the roadmap looks like. It's quite simple, but in simplicity, there's clarity of purpose. So the roadmap in relation to this particular thematic issue, our goal focus on by 2030, we want countries and partners to coordinate investments around shared national priorities, ensuring that resources reinforce sustainability, efficiency, and equity. The scope of operations at the global level, we want to promote coordination among donors, development banks, and private investors to align financing with shared principles and reduce duplication. At the national level, we want integrated digital transformation into national health financing strategies, ensuring budget allocation for digital infrastructure, workforce, and governments. And at community level, we want to ensure financing flows to the subnational and community level, enabling local-led implementation and participation. Now, what we want to see happen concretely, we want to see domestic budgets include predictable, dedicated funding for digital health. We want donors and partners to partner investments to align with national strategies and avoid duplication. And we want transparent mechanisms to track and report how digital investments are advancing UHC. Finally, some of the actions we may want to consider together, and this would be the last one, is integrated digital transformation into national budgeting and financing frameworks. We want to establish pooled and coordinated funding mechanisms to align partner contributions. We want to encourage blended finance models that leverage public and private and philanthropic resources. We want shared evidence on cost effectiveness to return on investment and social impact of digital health investments. And we want to see the promotion of financial transparency through better tracking and investment of investments and reporting mechanisms. So the roadmap, if you like, is those last three slides, and that's the agenda that we want to put on the table, get your input on, and work with you collectively on. I'll now hand it over to my colleague Christiana to take us through the Mentimeter.
Hi, colleagues. I hope you are listening intently. We have a Mentimeter now. I'm going to share the link in the chat box that everyone should see. You can also use the QR code that's on the screen to access. Once you're there, I will also share my screen to get your responses. It's about 5 questions, and it's about your perspective on what we just listened to. So 1 second, let me share my screen. All right. Okay, back to there. All right, I'm just getting that set up. 1 second. Allow. Okay. I'll join everyone here, presenting the screen. Okay, so, oh, it's loading for me, sorry. What is the one word that best captures your reaction to what you just heard? Okay, sustainability, ambitious, entropy. Money bags. So how did I'm really impressed that someone just used an emoji. I didn't know that was possible. Well done to you. I need to learn how to do that. Ambitious. It's funny because yesterday's word was also ambitious. It'd be interesting though to have you share in the chat box what about what was shared feels ambitious to you, and whether that ambition is realistic. Interesting. Accountability. Let me see the chat box. The code should be automatic once you hit the, yeah, exactly. We only see not the responses. Oh, weird. Is that true or is that now?
We can see the word cloud.
Okay.
Yeah.
Okay, great. Thank you. Okay. There's 30 people here, so let's have all 30 respond to the 32 people here. So let's have all 32 respond to this first question. Ambitious financing, UHC, national investment, limitations of funding, yes. Domestication, possible with government commitment, yes. I think I've already said that. All right, I'll go to 28 before I go to the next. Looks at 28 people. National investment. I love the money bags just get bigger and bigger. I'm curious as to what the money bag is supposed to represent, as in like we need more money, or that it will. Yeah, anyone wants to comment on why they put in money as their reaction to this? It would be interesting to hear from what angle you're presenting. Anyway, let's go to the next question. Okay, so from 1 to 5, 1 being not confident and 5 being very confident. How confident are you that digital health initiatives in your country or region or context receives the funding it needs to be sustained and equitable? 1 being not confident, 5 being very confident. All right. Sorry, I don't have the membership to Mentimeter that allows me to have middle kind of views. It's either not confident or confident. Even if you feel somewhat confident, unfortunately, we don't get that. But I've tried to fix that in the later slides. So unfortunately, you have to choose between not confident and very confident. Well, there's no gray area there. Let's wait till we have 30 people respond to this, and then we'll go to the next slide. So how confident are you that digital health initiatives in your country or region or context receive the funding it needs to be sustained and equitable? Sorry, it doesn't use the right English here. The funding it needs, not they need. Great. Okay. I'll let others continue to. Okay, so based on the presentation, which challenge do you think most limits progress on financing for digital health? So of the 4 that are outlined, which do you think is the most sort of like urgent or most limiting, basically? All right. And this is from your own work, your own perspective, your own environment. Thanks for the thumbs up, whoever keeps giving me thumbs up. I appreciate it. Oh, all right, thanks. We'd love to hear your views on this. Not enough domestic or funding from national governments' budgets. Okay. All right. Most funding is short-term or project-based. Yeah. All right. I'll get to 30 and then we'll move to the next slide. Four more. Hi, Jai. Go
Just
ahead.
wanted to say it could be a combination of multiple of factors
No,
here.
it could.
It
100%. 100%. Yeah, unfortunately, it's not like it's not so nuanced or sensitive enough to be like pick or choose combination, but I agree. It is a combination. In fact, I would argue in a way that lack of public awareness and public advocacy also, although it seems perhaps less important, if there was a public that was aware and engaged, they could call on, so for instance, there might not be enough domestic funding or national government funding from in their budgets, but I feel like also a public that doesn't know to ask for it or demand for it is also a key issue. And so it's like two sides of the same coin. So it's hard to just say like one or the other or a multiple, but yeah, I take your point. All right, we're gonna move to the next one. Thanks, everyone. And next question is, what do you think needs to change for digital health to be funded in a way that lasts and reaches everyone? These are just like words, sentences that come to mind in your particular space or landscape or context or area of work. What is the thing that needs to change? Can be anything. I can't see who writes what answer, so don't feel shy. Okay. Okay. More public awareness. Yep. More government ownership. Yep. Yeah, political will. Legislation, accountability, domestic resources, shared financing mechanisms. Government must take the lead and walk the talk. We had that yesterday too. I feel like that might be the same person. Literally, word for word. Walk the talk. Is there any comments in the chat box? Yep. People in power. Sorry, I don't know if you can see my chat box on the screen. Ministries of health have to become more skilled and comfortable with understanding what's needed for digital health to work. Okay. So if they know, so the argument is that if they are more skilled and comfortable, then they know what needs to be funded or what the resource gap is, essentially, is the argument, right? Yes, Jai.
I think investing for a couple of years and then expecting a miracle to happen in terms of the results is kind of difficult. I know,
Yeah.
in fact, like we are in a boot camp right now with 20 countries and 54 participants. And then we were discussing some interesting use cases. For example, a country invested in the digital public infrastructure, apparently not for health focused reason, but then later on realized the potential that it could do wonders. And then 16 years down the line that, they are being used as a case study or on an example. So if we look at something that like we can achieve in probably in a month or probably in a year, it may be little too far-fetched to actually expect that. So it has to be done in a proper way. Also, we need to have a bit of a patience in such investments, especially in the enabling infrastructure. That takes means those investments in enabling infrastructure are not small, and then not all countries will have a wherewithal to do that. It's a big decision also, and then especially when there are scarce resources, naturally the focus, especially on the political leadership, will go to something that can be achieved and that can be proved to the citizens that the government is actually focused on meeting their basic needs. So there's always this there's always a need for balance, and then you know so I would suggest that it's actually difficult to actually have something in a short term. So this is something I would like to highlight, especially in terms of digital in health, and then investing in the public infrastructures that will probably yield results once it reaches a certain critical mass and public starts trusting and using the services more.
Yeah. Yeah, those are fair points. Thank you, Jai. All right. I think this is the last question, and then we'll get back to hearing from our co-hosts. So on skill, I thought, oh no, sorry. Let's just skip that question. Sorry, I didn't delete it. This was meant to be the one that you were to answer. This one, the last one, because it gives you a little bit more variety in your choices. Apologies. How achievable do you think these proposed ambitions and collective actions? Oh gosh, I didn't even proofread. Collective actions are within the next 5 years. So, so Frank had presented you with 3 ambitions and then a list of collective actions below it. How achievable do you feel they are within the next 5 years from 2026 to 2030? Fully achievable, not achievable at all. I love the very honest answer. Let's have everyone, there's 41 people on this page. Let's have everyone answer. Let's hear it. Partially. Well, I'm glad that there's so far no unsures or neutrals. Everyone seems to have an opinion on that. That's good. Partially, fully. And why I say partially, there, if you're confused about why there's like only somewhat and only with significant collective effort, I think the difference between those two, between only somewhat and partially, is that only somewhat means partially yes, but things need to really change or need to be kind of really reformed. And partially, the other option, partially achievable, is sort of assuming that things sort of progress as they are, and within that progression, things are partially achievable. So it's sort of like two sides of the same. It's like kind of one or the other. Yes, somewhat, but only with significant collective effort, or given the current kind of status of things, yes, you feel it's partially achievable, or you think it's fully achievable. It's, realistic, if we're all behind it. All right, 23 have answered. Let's get up to at least 35. This is the last question, and then we'll stop. We'll get back. Thank you. One more, let's get up to 35. This one's an easy one. No thinking. Just knee-jerk reaction. Do you think it's achievable? Do you think it's realistic? Do you think it is somewhat realistic, but we're gonna need a lot of work? Your views on this are really important, because we will know, whether there, is still some big shifts that need to take place or not, or whether what we've presented seems quite realistic and achievable, and that's a great start, a great foundation to begin from. Okay, I'll give it, yeah, let's get to 30, and then I will end this. All right, I don't want to force anyone to do this. Thank you so much for your inputs. Really fun, really interesting to see what you believe to be the position here. Thanks again. I'm going to stop sharing and over back to Frank. Thanks again, everyone.
Fantastic. Thanks, Christiana, and thanks everyone for sharing your thoughts and ideas. I'm now going to invite our co-hosts to share some of their reflections on these these different themes, ambitions. Alison, can I start with you? What are your thoughts, given the kind of dire picture that we were confronted with earlier in the year, and looking at, you know, taking a little bit of a step back and looking at, you know, the broader landscape. What are your thoughts in terms of resourcing investment for digital health leading into 2030?
Thank you, Frank, and thanks for inviting me to be part of this. I'm Alison Raw, from a senior advisor from the G20 and G7 Health Development Partnership. Previously, I was at the UK government, and I've also worked for the Commonwealth Secretariat. So all that experience has really helped me look at this through a different lens from many different sort of countries. I know the Indian presidency of the G20 was very much focusing on the sort of the digital health space, and there was a lot of work started there. I think one of the issues is we need to start with a common language, and what digital health means to you means something different to somebody else. So there's something around how we have that alignment and have the common language. And I think there's also an alignment and a common language needed for the financial side. Again, what finance and digital health means to the UK, very different to my Chimwelis and Chimwenis out in Malawi, who obviously have been hugely impacted by recent geopolitical changes. At the G20 and G7 Health Development Partnership, we launched a health taxonomy earlier this year in June, and that was a real call to try and ensure that there is that alignment, so that partners, so that development banks, so that the private and public partnership can come together on the same terms, so we're all on the same page. Now, we don't want to spend our entire discussion saying whether it's tomatoes or tomatoes, potatoes, potatoes, whatever, whatever it is. But with our health taxonomy, that really allows those G20 countries, G77 countries, G7, the BRICS, and regional partners like the ASEAN, like the Pacific, to come together with a common language. We all want the same outcome. We're just coming at it from different paths and different journeys. So we just need to make sure that we utilize something like the health taxonomy, which I can send a link to, which will help us all start from the same page. One of the other issues, Frank, I think, is there's a gap analysis needed, and you know, with your sort of your toolkit and your roadmap, I think again that gap analysis is really required. I'm fully aware when we talk about digital health again in the UK, very much different from those in some of our LMICs and our SID countries, so our small island developing states and our low middle income countries. There is an argument to say that those countries that are starting from a lower baseline actually have the opportunity to supersede what we're doing perhaps in some of our G7, G20 countries, because technology is advancing all the time, that there's that opportunity to actually do it, learn from the mistakes that have happened, but to do it straight away as such, without going through all the hurdles that other countries have been through.
Fantastic. Thank you, Alison, for those reflections. Jai, let me pass the microphone to you. quickly. You work very much on supporting governments and others on the technical side, the much more sort of I don't want to call it practical side, but you're working with much more with the governments and on that technical side of things with strategies and what have you. How have you experienced the current context, and how do you see the future in relation to resourcing and investment for digital health?
Thank you, Frank, for the question and also the opportunity to participate. Um, I think, yes, like as you mentioned, that this is also a challenging time, but also I will also look at it in a positive way, because the countries that we have been working together are also putting their, minds together, and then seeing opportunities for self-reliance. I think this is also, in a way, a positive development, because we can't always be dependent on somebody else. Like, it's our country, and then there is a commitment to the citizens to deliver these services. And then, of course, like, I think we have moved from a time where there were doubts regarding digital in health, but then, like, right now, yes, everybody believes, but it's only that expectation that it can deliver some miracle at a very short time. Is something like, it's kind of like that needs to change. Also, where to invest, because, like, usually to invest in foundational, like, building blocks actually takes a lot more time and effort, and then also investments. But then, like, once it is done, the return on investments is also quite well realized over the years. So that is something that, people are looking at it, like, in our experience working with countries in the region, we do see at least thinking or shift in terms of countries considering other options, not only relying on those, donor or partner funding, but then, like, how they can leverage their own. But that will take some more time. But this is where, like, our work also with the countries through convergence workshop methodologies, where we are able to actually get multiple stakeholders, both within the countries as well as, like, those actually involving them. But the supporting partners, our development partners, are not only supporting financially, but there are other means, like, for example, developing the health ICT workforce, or the workforce that is actually digitally skilled and trained. And then that is more important, because it's not only those applications and infrastructure that we invest in, but it's also the human resources which are skilled enough and capable to actually undertake those tasks. So that is something, like, from AHIN as a regional digital health network. This is an area that we are particularly focused on building the capacities in terms of offering them peer learning, also peer support, sharing of experiences, what worked and what did not work, and then how we could actually uh, plan in such a way that we could optimize those, scarce resources. So one way of doing it is, like, most countries have digital health strategies, but they may not actually relate to the realities or aligned with the national health strategies. So that is something that, we are actually discussing with at least those countries that we are involved, and making sure that those alignments are there, and then also having an investment roadmap, a plan for at least 5 to 10 years is very important, because most of the times the strategies are not backed up with a blueprint and then a costed plan for implementing the strategy. So the strategy is mostly a PDF. It's a nice document to look at. That is something that we are actually working on right now. I'm actually in the middle of the second day of the 3-day first ever buildable digital health blueprint bootcamp, together with the World Bank right now in Manila. We are conducting for 54 participants from 20 countries. This is exactly, in fact, tomorrow is the day that we are actually going to work on how we plan the investments, and then also do the costing in such a way that we can also show, means those facilitators who will be working with those governments can actually also show by when that these investments can actually lead results. This is something that is very important for someone in the government, because they do have multiple pressures, and then priorities where this money should go. Usually also the investments in digital health is only a fraction of the total available budget for health. So this is something that we are actually on the work, and then like maybe and we do have plans like these facilitators now. Once after this boot camp, they will also go back to the countries, and then there will be more trainer or facilitator sessions, and then that can actually be a chain reaction. This is something that currently I would say that we are working on, and hopefully focusing also on the building blocks and basic things like the registries, which are really very important, and investments in terms of digital IDs, because like many countries that we see that there are multiple IDs and there is no critical mass where there is a national ID that could be actually used for digital health, and then also the registries are missing actually. So more focus is mostly on the project based, and then once there is a grant dries up, or if there is a issue with donor funding, the whole thing comes to a standstill. This is I think it's a culture change or the approach change that is going to take some time, but I think especially with the developments since the beginning of the year, I think countries are actually thinking about having their own means of prioritizing and investing in their own funds. This is something that we are seeing. Of course, it's going to take some time.
Fantastic. Thanks, Jai. Well, that leads me in nicely to inviting Brendan to share some reflections from a UN sort of perspective. The UN as a set of institutions has taken quite a hit in terms of funding. Many of the different agencies are seeing digital health as a means of optimizing increasingly scarce resources to deliver services for their particular cohorts. I wonder, Brendan, if you could share some reflections on how you see digital health resourcing and investment leading into 2030.
Thanks, Frank, for the question. And I think I also start by acknowledging my fellow co-hosts and, of course, Transform Health for bringing us together. I think in the framing of the presentation, you framed it right by talking about what needs to change, who needs to act for it to change, and how do we work together to achieve that. And I think as I think through the response to the question, it's I'm guided by some of those reflections. So, of course, as you mentioned, the UN and the member states have been affected by the funding cuts. And a key reflection, I think, that has already been come up from my colleagues is the importance of addressing bottlenecks around the adequacy bit, which is what the cuts mostly affect, but also the issues around predictability and ensuring that funding is aligned. So although we may look at money has decreased and that may affect our ability to achieve the 2030 goals, I think there's still bits and there's some things that can be done for us to ensure that everyone is able to benefit from digital transformation. I think in terms of the reflections I have and from a UN perspective, and I think building a bit from what Alison talked about in terms of strengthening alignment. So I see there's opportunity to build on some of the existing initiatives, the normative initiatives, for instance, around strengthening digital public finance as a strong foundation for other digital tools to be budgeted for and paid for, because that's a symbiotic relationship I think that you can benefit from. Jai talked about the importance of digital public infrastructure. Again, luckily there is an increased move for countries to invest, for instance, in simple tools like digital identity. And that's also a strong basis for which we can then work with member states to ensure that whatever solutions are being developed build onto existing strong country systems. Also worthy of mention, I think, I remember this because of Allison's, is the normative work around making sure when we talk about digital infrastructure or digital health, we are talking about the same thing. So, of course, the UN primarily works on normative policy and guidance and how that can be adopted in countries. So the discussion that the G20, G7 group talked about, I think, is also a good bit. But a personal reflection in terms of other aspects I think are important to move forward in terms of moving towards 2030 is two bits around alignment. So there's the governance bit, which I believe was covered in the earlier sessions. So what governance tools need to be in place for us to be better aligned to do more with the resources that we have? I think as we reflect on the financing, and especially the limited resource envelope, we need to think better on how best can we work together. And again, thanks to Philip, I had you refer to the Paris Agenda for Action, the Paris Agenda, the Accra Agenda, and now we have the Lusaka Agenda. So there's a lot of positive talk towards working together, and I think digital health and digitization can also benefit from that. I think the last one, which is linked to the reflections you had around blended finance, is how best we can use public finance and domestic resources in the current context. I was observing the Menti, and I noted a lot of government ownership, more government resourcing. And to me, the reflection that I took from there, 3 points mainly. So first, I think public finance could be used to signal what the country prioritizes the agenda. For instance, now I'm studying in East Africa. I know that community health is an important agenda for most of the governments here. And if there's a focus on the community health tools and government has invested, then even the private sector and the philanthropies would be able to ride on a government-driven agenda. The second point is de-risking to enable that the private sector to be able to invest. First is the obvious bottlenecks in financing around access to capital, which many of the innovators within such countries face, but also the easy de-risking, which is linked to a point I made earlier, is, for instance, strengthening some of the digital public infrastructure. When Frank mentioned at the start of the call that his power had gone off, I almost asked him whether he was in one of my countries, because I can talk about the countries. So it becomes a challenge once you are investing in very good solutions, but you don't have power, you can't sustain power, you can't sustain connectivity. So to me, I think even that foundational investment that Jai talked about is a form of de-risking that public resources can go to, and hence be able to encourage private sector investment. My last point is thinking of a more cost-effective use of public funds. In blending, we simply talk about bringing together both public and private funds, but we know that private investors, for as long as the risk is lower than the reward, they are able to invest. So when I talk of being more cost effective in how we use public funds, is to ensure that we only blend for where we know that there's a higher risk if government does not play a role in driving that agenda. And I'm sure there are areas where that could happen. So essentially, as I conclude, as we think through the path to 2030, especially with the evolving funding landscape, we need to have a bit of more clarity of where to invest and how to invest. And I think some of the thoughts are supposed to move us towards that direction. Thank you.
Fantastic. Thank you, Brendan, for those thoughts. That leads me neatly to Rishab, and let me invite you to reflect a little bit on how the OECD sees this, the current context and the change in landscape. And I want to ask you in particular around the coordination of investment and the appetite of donors and different stakeholders. And also, so that's one set of questions. The other one, sometimes trying to track funding for digital health feels like chasing a rabbit, like Alice in Wonderland, chasing the rabbit down a very deep hole. You'd never get to the bottom of it, and it keeps changing and morphing into something else. I wondered what your thoughts are, given the new context we find ourselves in trying to address that sort of landscape. Over to you.
Sure. Yeah. I'm happy to jump in. Thanks again, Frank, and thanks for everyone on the discussion of this very interesting and growingly, I think, important topic. I don't have an easy answer. I think that's probably the first thing I have to say. OECD countries, I think, for context, are normally, across the globe, but higher income countries with more structural investments in infrastructure, not just within digital, but also within health systems. So the kind of the budgeting and investment question is a bit different, but I think there are a lot of kind of similarities. I think one, as people have mentioned before, I think um, investments in digital infrastructure have, I think, grown, and we haven't really had the perspective to look at it as an essential capital expenditure. And so we've been trying to, and we don't have an answer for this yet, but I mean, the OECD does a system of health accounts, which tracks health expenditure across health systems in OECD countries. This is mostly in terms of healthcare delivery by hospitals and healthcare services. We're trying to capture that expenditure dedicated to digital infrastructure specifically, and that includes procurement of ICT or EHR systems and these kind of core infrastructure guidelines. But that's something that we haven't really seen or been able to spark discussions around standardized definitions for capturing that information. And that's something that we're hoping at least can start to really capture that kind of capital and operating expenditure for digital infrastructure. Now, there's another part to that I was hoping to hear a bit more, but I don't think I've heard it yet, and I'm hoping maybe it comes out in the breakout groups. But for these large investments that rely on kind of maybe unclear scope of infrastructure investments, evaluation and assessment has been the core tenet of ensuring that these investments are, one, sustainable and returning value for the health systems, and or at least some in some ways cost efficient and effective. I think we are working on this now. We're working on our digital health indicators, but I think this is something that maybe globally is a better conversation to have, especially when we look at USC 2030. I think for one instance, we're looking at indicators of readiness, which is like having the core processes and people training in place so that digital tools are usable across the health system. Adoption, which is actual usage of tools, and then usage, which is actually the using of the tools in care itself. And so understanding, let's say, where the investments lead to use, penetration, and adoption in health systems really kind of paints that investment picture a bit clearer and understands where that kind of value return could be. Yeah, I could talk about this all day, so I don't want to get too down the rabbit hole. But I think where we can agree some basic granular standards for digital health expenditure in the midst of CapEx and OpEx, but also really incorporating clear frameworks for the usage and adoption of digital health tools and indicators that we can compare, so we understand where investments are going right, which ones we can rely on, and how to ensure that they're delivering value, basically usage of these tools and enhancing access to care. Those things go hand in hand, and I'm hoping that we're inching towards that. And I'm worrying that, leading to looking at 2030, we have a lot of work to do, but this is something that the OECD is definitely looking into for relevant countries.
Fantastic. Those are some great reflections there. Thank you so much, everyone. And that tees us up nicely to move into our next session, which is going to be an exploration of the different ambitions that we've set ourselves. My colleague, I'm going to stop sharing my screen and invite Christiana to share your screen so that we can move on to the Miro boards and capture some of those thoughts and reflections around the different ambitions that we set ourselves. Please, everybody, also think of these in relation to what you've just heard from our co-host here, whose reflections, I think, have started a conversation that I'd be fascinated in sort of continuing, and I probably will be knocking at doors over the coming couple of weeks to get more insights as we build this out. But please let's take advantage of all of this conversation to build out this Miro board. Christiana, over to you.
Sure. No, it's all good. It's all good, Alison. I see your comment. All right, I'm going to share. I put the link in the chat box for everyone to join, and then I will go over there now that we are all set. So please, everyone, click on the link, and then I will go over there. Sharing. Great. All right. So everyone, I think you've been to Miro board before. There's only 7 here. Please, if you are on the call, click the link if you can still see it in the chat box to come over. And then we'll start this conversation. So I think everyone has been on Miro before. Essentially, we will start off with this first board, which has the first ambition that was shared as part of the roadmap under this theme. And Alison will take us through the conversation. If you want more sticky notes, so these are sticky notes here. Please write your responses in the sticky notes. If you want more sticky notes, you go to the far left here, you click on this little post-it note sort of square thingy here, you select your color and you bring it over to the board. So that's how you do it. And over to you, Alison. I will make this bigger so that you can see the ambition in which we are unpacking. Thank you.
Great. Thank you, Christiana, and thank you, Frank. So the question that I want to pose is around the sort of the domestic side. So the domestic budgets, which include predictable, dedicated funding for digital health. So what I'd like to do is think in your own countries, your own reflections around where these budgets can come from. Now, we've talked about them coming from health budgets, but I would actually say we need to think wider than that. It's all about where the treasury in your own country, where the finance money is, and how it's spread across government. So a starting point to think about how people engage with their own treasury. The other thing is to also think about is that private-public partnership and the multi-development banks. So, sorry, I can't get onto Miro at the moment, so I'm hoping one of my colleagues can assist me with this. And over to the people that are online in terms of their views around domestic budgets and how we can get some dedicated funding for digital health. Again, I would say don't be restricted to health departments. Think about the benefit for this through business departments, through innovation funds, through tech funds, through startups and the entrepreneurism of companies that are out there in this space. Christiana, can you make your screen a little bit bigger for me so I can see some of the comments? Sorry, thank you.
Yep. So Lizzie says institutionalized digital health financing. Someone visiting Pathfinder says this could include PPPs, so private, I guess it's
Public
private-public
partnerships, absolutely.
Yeah, allocating. Sorry, go ahead.
Sorry, and I think I'm just looking at the typing up there. I need to be explicit on that return on investment. So it's all about the economy, isn't it, in many government departments? So how do we demonstrate, how do we prove that there is that preventative, that return on investment for digital health? It's very difficult to demonstrate prevention. How do you prevent something that's not quite happened yet? Which is one of the issues we always face in public health. But let's make sure we have the data. Let's make sure we have that gap analysis. Let's make sure we have the evidence base and the research to demonstrate that actually this makes a difference. There is lots of evidence out there from the World Bank, from the WHO, McKinsey, Wellcome, etc. Again, I am all for stealing with pride. There's no point in us reinventing the wheel in this space. Steal with pride because we all want the same outcome. So, sorry, can we pick up on some more of the comments there?
Yeah. Let me expand this one a bit. Okay. This person says, Institute of Digital Health Financing, governments should embed digital health allocations within annual health budgets rather than relying on donor or project-based funding. There's also this one. Need to look at funding within the health sector, but also budget allocations for foundational areas beyond health, including digital public infrastructure.
So one of the things I would just come back to the comment about it being government funded, and the fiscal envelope for most countries at the moment is tightened with the current geopolitical situation. More money, as you can see, has been spent on defence. Even here in the UK, the ODA budget, etc., has been reduced. So we have to think of innovative ways to look at this differently. What's been happening hasn't worked. So let's try and think outside of that standard funding, and let's try and think of more innovative, new ways. What about the sovereign wealth? What about those people, those organisations that have some of the deepest pockets that need to be on board with this? Some of the philosophical foundations. What about some of the, like the Rockefeller Foundation? What about the Rothschilds Foundation? We need to come together to help solve this. And think of different organisations, sovereign wealth, private sector to help fund some of this, because governments have no money to support this at the moment, with the unfortunate fiscal difficulty that we're all facing round the world. Lots more comments coming up.
Just a quick comment from me to throw in the mix to reflect on. In many countries, a good number of countries, up to 40% of health expenses come from out-of-pocket expenses. So I think we need to consider the ability of the public health system to respond to people's needs, and if people are already being failed by the system, and there is an alternative to adopt more effective or to access more effective healthcare through other providers, then what is the role of government in enabling that wider ecosystem, I guess? And how can digital health sort of help optimize the relationship between different sectors, private, public, not-for-profit, and what becomes the role of the state and the public sector in coordinating the whole ecosystem to ensure standards are maintained, that there is interoperability, sharing of data. So I just wanted to throw that in. A lot of money that goes into the health system comes from people themselves out of pockets. They don't have choice at the moment. How can we change that?
Yeah, no, you're absolutely right, Frank. And I think there's something that has to be a very clear governance, so that an accountability when we're thinking about private-public partnerships. Otherwise, businesses have money for a reason. That's their whole reason debt is to make money, right? For us that work in the public sector, obviously, it's more about the sort of the common good. So bringing those two sort of ethoses and cultures together, there has to be strong alignment, accountability and governance. Otherwise, you will end up, certainly in the UK, as we've seen, with some really interesting decisions that haven't been procurement decisions in health during COVID that hasn't been in the benefit for people. So I think there has to be that strong procurement alignment and governance and accountability if and when we go down that route. Sorry, further comments? Local fundraising. Again, lots of people are fundraising for all different things at the moment. So how do you raise the bar for people to put their money into digital health as opposed to put it into cancer services or Water Aid or any of the other organisations? It's really tough out there. How do we bring the likes of people like the social media companies, or the Googles or the Microsofts of the world into this conversation? Because again, they have very deep pockets, and just putting it out there for conversation. Again, thoughts?
Yeah. I mean, do you feel, Alison, that, I mean, clearly you bring it up because you feel that there's a gap there in that conversation. And where do you think that these conversations need to be had? Because I think at the global level, there is, for instance, when we were at UNGA this year in New York in September, we did have a conversation with the private sector, and including the likes of Meta. I don't think Google was there, but these were the kind of focal points or kind of targets of our conversation meeting. I think those conversations are happening, but they're not translating to what I think you see as sort of the ideal kind of relationship there. Where do you mentioned this also on our prep call. Where do you see this conversation not happening? What intersection is it this conversation needing to be had at, basically? Like,
You're
they are
absolutely
happening, but
yeah,
go ahead.
And absolutely right. So lots of conversations, lots of chats, lots of at all different levels, whether it's at the World Bank, whether it's at Davos, whether it's at the G7, the G20, UNGA, name an international fora, and conversations are happening on many different things. People are about to go to COP next week in Belém about climate change. What's not happening is the action, right? The follow-up. So the conversations are happening, but it's like, come on, crack on, we need to do something about it now. We've had the conversations. We're going round and round in circles with the conversations. So I would say, and sorry, this is my frustration from having worked in this area for nearly 30 years. I think there needs to be accountability. I think maybe something like the World Bank can actually have those conversations and then be able to distribute the money through the multi-development banks or something. Look, I don't have all the answers. If I would, I'd be at the I'd be the Secretary General of the UN or something. But what I do feel is there needs to be more action and less talk. And I think there's something around how we can have more communiques. Great. We have more G20. We've got the health ministers going on at the moment in South Africa for the G20. Great. But what comes out is a communique. And where's the accountability that governments actually have to follow through for that? So again, there's something around people, legislation. People vote their ministers in, their MPs in. I think there has to be a sort of a two-way pincer approach, not only at sort of social movement, but, and I'm not advocating for rioting in the streets, don't get me the wrong way, but is there something around how the World Bank or the UN or something at that very senior level says, right, Microsoft, Google, X other provision, put your money where your mouth is, because we've talked and talked and actually need to get money out to the people that need it. And I could apply that to any other thing, whether it be, loss and damage for climate change or digital health.
Well, that's something to mull over for sure.
Sorry.
No. I mean, you answered the question. You answered the question, but it's also kind of, yeah. If it, like you say, if you had like kind of that silver bullet, then you would be the Secretary General. You'd fix all the world's problems. So it was more kind of like, it was more not rhetorical, but it was more kind of like, putting it out there, like what would be that kind of tipping point?
Yes. So
to
what's
get,
it within our gift to be able to do, right? What can we collectively do? What's within our gift? And there's lots of great ideas popping up on the Miro there, and it's how we then take those actions forward, which I think is where the difference is being made.
Rishab, I see you have a question. Your hand up.
Yeah, sorry, I don't want to interrupt, but I did see some interesting notes, I think, in the board, both in terms of the private sector engagement, but also aligning budgets to strategies. And I think this actually aligns pretty close to some OECD countries that we talked to, in the terms of, I mean, private sector financing should be, I mean, not to be rude, but should be focused on the areas that are really expensive and risky for health systems to invest in, right? And so where there are domestic budgets that can be dedicated to those longer term infrastructure and governance investments in digital health, we can leverage private sector co-financing or public-private partnerships in those areas that's, experimenting with new digital tools in clinical workplace that needs pilot testing and evaluation, right? And then those are the more expensive parts that are riskier. And then if they can be co-financed, then we have this infrastructure to help scale that across the system. So I'm seeing, I think, a lot of this across the board, but maybe it's a bit of segmenting kind of that risk element of these investments. Domestic budgets can be built for these long-term infrastructure, and then we can use private-public partnerships for these kind of newer care models, innovations, and use that as a way to capture evidence and eventually scale it nationally. Anyway, sorry, I didn't mean to jump in. Thanks.
No, very, very fair comment and very good comment. Thanks for that, Rishab. I think we're going to move on to, Brendan, please go ahead. And then we'll move on to the next board.
Yeah, thanks. So coming on in a related point, and I think it's also linked to that I'd mentioned earlier, when you look at the board here, there's lots of sources being referred to. And I think in the context of the roadmap, we need to start thinking of which source is better suited for what purpose, which I think is a point Rashid was talking about. So oftentimes I see a bit of misalignment in terms of what we aspire to use the public finance for versus what it actually could do best. So I think part of the reflection as we bring together all the thoughts on this ambition around domestic budgets, I think for me to emphasize the very catalytic role that public finance can do to shape how all the players are able to finance in the context of digital health and broader digitization. Thank you.
Thank you, Brendan.
Thank you. Muted.
Am I?
Right.
I don't think so.
Right, fantastic. Thanks for that. We're capturing all of that. Sorry, I was capturing some of those comments. Let's move on to the next board now. Jai, did you want to make a comment on this, or would you like to?
Yes, yes. Just a quick comment before I may have to actually step out. I think one of the areas like where private sector, like also in private sector investments are also, I think, are related to how there could be a return on investments. So usually when those things are clear, the investments are also come in, because when it is from the private sector, unless otherwise they are the corporate social responsibility funds, which some countries do have. Actually, they have to contribute a certain percentage as part of the CSR. Unless otherwise, that model, if it is going to be an investment model, then the what do you call the the structure, or there should be a clarity whether it's in regulations or legislations, and then how the government sets out the environment conducive for such investments. I think that is also very important. When they see a confidence that the investments are going to give them the returns, I think there will be more confidence. I think that kind of confidence should also be reflected in terms of any of the national strategies. And then the governments have a role in fact to bring about that. So I think if when we are talking about the private sector engagement and also investments from them, then they definitely have to see that how early or how best that they can also get those returns of investment. It's not going to be a sunk cost. Thank you.
That's a very good reflection. And this whole issue of costing, who pays, what they're paying with, and how. Some people are paying out of pocket, some people are paying through taxation, people are paying through with their lives, some are paying through their political capital or whatever. I think that complex matrix of cost benefit needs to be understood, and maybe just beyond just the narrow financial aspect of it. Let me pass over to Christiana now after a great session on the first board, and to lead us.
Yeah. So if you go slightly right on your board, you'll see the next board and next ambition. So the next ambition that we've set out under this theme, by 2030, donor and partner investments will align with national strategies and avoid duplication. So if you can join me on the second board, someone has taken over presentation of this presentation, so I can't bring you guys over with your cursors. So you'll have to come over yourselves. Please come over to the right. You'll notice on the board, you're over there on the left before, now we're over here in the middle. Come on over to the second ambition, and the co-hosts that are leading this discussion are Jai and Brendan. Over to you.
Thanks very much, Christian. And I think Jai is probably dropping off. I think it's a good transition from the previous conversation. Of course, it's very important that we ensure donors and partner investments align within national strategies and avoid duplication. We'll use the same approach as we have done on the past board to share some reflections based on what you know from your country experiences, but also a bit informed by the reflections you may have had on the call today. I think as I strain my eyes to start reading, because I'm still very far, I see first the importance of a costed national budget and digital health strategy in place. I think that's an important alignment tool. Remember earlier when we were reflecting on the domestic resource, I talked about the adequacy itself being explicit and the importance of costings to ensure that we know what we need. And I think based on that, we then start mapping to know where that will come from. Other alignment tools, we may need to revisit the principles of donor alignment. I think also that's a good point. And Frank did mention the Paris agenda. I remember the Accra Agenda for Action, the Paris Declaration. There was another one in Ethiopia in 2015. I can't remember the name. And now for health in Africa, we have the Lusaka Agenda. So there's all those aspects which emphasize the usual things. And I know I saw colleagues from Nigeria, for instance, they are currently within a swap. It would be important to know how, even within a broader agreement to work together, how you frame collaborations around digital health. I see promote data transparency, establish shared dashboards. So in my submission earlier, I talked about the structures for collaboration. So I said fall within the governance, but then so there are also tools for collaboration. So of course, data is important in driving collaboration. And in some of the countries, we know that, for instance, they have joint planning, but also now joint monitoring of plans, which I think is important. Now, in terms of an example, previously, a bad example around fragmentation, I think I'm Ugandan and I used to work in Uganda. I remember there used to be a map of which partner is working where and what are they doing. And you'd see so many pilots thrown all over the country. And even just having that glance in terms of who is where and doing what was a bit of an important alignment tool. So I think that point around data is important, but it's very closely linked with strengthening coordination, because there has to be a structure that has a look at that data and takes action. See costed again, then do we need coordination mechanism again? I think there's a lot of coordination mechanisms. So still structure for coordination, tools to be used within coordination. I know, and I'm yet to see a mention of private sector here, because I know we talked about donor and partners, but in my submission earlier, I talked about potentially financing instruments being a tool for improving alignment. So it's so I think so vital, however, should be locally funded. Heavy donors, partners must have tertiary or primary roles. So this bit talking about the roles of the donors probably is an inverted way of saying governments need to lead. And I know the previous sessions within this Digital Health Week probably have talked a bit more on the governance part. So I think it's also good to see the interrelationship within this session and the previous ones. I see a hand up by Chris Castin. I think you could come in.
Thanks, Brendan. Yeah, maybe just picking up on your last point of countries need to lead. So I think that 100%. And I think then the role of there being a costed budgeted national digital health strategy in place, it really sets the vision of the country. But then ensuring, and maybe it's through the donor alignment principles or through other mechanisms, ensuring that donors and other funders, including private sector, are very much aligning their investment to those strategies. So it's not about their vision, but it's about the vision of the country, of what that digital transformation looks like. I think as well, another thing that I think that is really kind of supports this is, and kind of picking up a little bit about Allison's comment during her earlier remarks around a taxonomy, is having that standardized or aligned language of what the investment areas are that would also then support the coordination between kind of donor investment and government investment and investment of other stakeholders as well. And Transform Health is speaking also with the development partnership, which is great to align these efforts with the broader work they're doing around kind of health taxonomy, but we're working together with partners, including a number of you on the call, so OECD, World Bank, UNICEF, and others, to develop a digital health investment taxonomy as well, to really kind of help support this, because kind of the areas that different investors and funders finance, we're not all speaking the same language of where those investment areas are. So a good starting point to then improve that kind of transparency and accountability of that investment is to kind of align on what those cost areas of investment are. So we're hoping these kind of early stages of this work, but really hoping that this will be an important contribution to this as well. And very much want to kind of gather the insights of different stakeholders in developing and kind of validating and sense checking that taxonomy as we move forward.
Thanks, Justin. Jai, you could come in as
Yes.
co-facilitator, but also with your submission.
I actually I was about to share what we do, but then maybe I will make it quick, and then I may have to drop out, Brendan, because it is kind of late, and then I have sessions from early morning. So this is something we actually do. We have been doing since a long time now. Like we have worked with 10 countries over 14 iterations, what we call is a convergence methodology approach, and which was also followed by our peers in Africa as well, and then like also by UNICEF in the Caribbean in a smaller extent. In fact, like UNICEF has been a long-standing partner in our convergence workshops right from our first one in 2015. So this is a methodology that we use, and then like of course like we use a variety of tools based on the country context and the priorities. We work together under the leadership of the Ministry of Health, and then like we bring together a variety of partners, like including in the investments banks and not only those from within the country, but also external. And then we get them to see the national big picture, where the investments are, where the gaps are in terms of governance, architecture, program management, and also standards and interoperability. And then we get them to align if there is a national digital health strategy, and then if that is functional or if it is not functional. So we work together with them in terms of resource allocation, also a costed blueprint, and then also make sure that we follow up also with them in the implementation journey. In fact, like one of the countries that we worked with did not have a strategy, but then like after the convergence workshop, and then working together with the WHO country office, the country office really took an effort, made sure the country has a clearly defined national digital health strategy with the short-term, medium-term, long-term, goals. And then these were identified as a menu for the donors and partners to actually invest or support them, rather than doing it in their own way. So this is like a menu. Okay, these are the priorities for the country, and then if you want to support, and these are the areas in the short term, medium term, and the long term. And another thing that I wanted to highlight before I close is at the end of every convergence workshop, it is not as just a set of recommendations. That is the easier part to come up with. But also we try to see whoever is the partners who's joining such workshops, we also get them to actually commit to certain support, whether it is not necessarily only in terms of finance, but also there are the other means of support. So we actually get them to actually commit to a donor or a partner statement of support in line with what was agreed in those convergence workshops. So this is something that we have been doing, and then I would say that yes, sometimes it takes more than one iteration to get that kind of a convergence, but it really works because everybody realizes, because sometimes in our workshops, the same, including some of the UN agencies, they never knew that they have probably invested in some things that is very similar. They didn't even know. Only during this workshop, they even came to know, oh, we are doing the same thing, including some of the maturity assessments. Then it becomes easier for them to see how they could optimize, work together to make sure that the resources are actually aligned and spent in a better way rather than being redundant. Thank you.
Thanks very much, Jai, and I think you give a very good example. To me, while we are talking about donor and partner investment alignments, I think what I pick from your point, which I think is also of importance, and I know was also raised in the situation analysis, is the normative actions around having the policies and strategies in place, because those are tools that can be a basis for alignment, but also components like enterprise architecture, like having basically defined norms of how we as partners in a specific country or even in a specific region work together. And that will easily then become a basis of also aligning funding and limiting duplication. If you know you're working on similar systems, your maturity assessments will be similar. So even the processes which we kind of then take for granted are easily aligned once we sort out the normative part. I think the other bit as reflecting around donor and partner investment alignment. So at the global and the regional level, there are those alignment initiatives that I did mention. And within the national, you have the governance tools and financing instruments potentially to also aid alignment. But I think I would want to see colleagues, even including raising your hands in terms of alignment actions at community level. Community and service delivery level, because I think that's also an area. If you look at what we have on the board so far, a lot of it is what we do as partners at the national level, but then a lot of the misalignment and duplication actually happens at actual service delivery level. So I see, Jai, I think hopefully you have a new reflection. Or
Brendan, yes,
okay,
what you said actually motivated me to share one more thing that was happened recently. Just 2 months down the line, we partnered with UNICEF Cambodia, and then of course the UNICEF regional office to have and then the Ministry of Health Cambodia to do the first digital health transformation workshop in Cambodia. So this was like, I would say, like a pre-convergence, and then so this was the time that we were able to get a variety of partners, and both within the country as well as others who have been actually working there to see the big picture, what is happening over the years. And then like right after our workshop, now WHO has actually put in the regional office and the country office actually put in consultants who are working on developing the health enterprise architecture. And then just couple of days back, the European Chamber of Commerce, they conducted their private sector event, a health forum. And then so if you look at it, like once we have such a forum where like we are able to actually get to establish what is already there, who's working on what, and how we could work together, everything actually comes together. So you can see that there is actually a convergence happening already. Like what could be the kind of enabling infrastructure or the enabling support structure from the government for everybody to come together. So that is actually taking shape. This is something that I wanted to share, and then of course we'll be happy to share those links which are already available in our LinkedIn post, but we'll be happy to share that. Thank you.
Thanks, Ajay. Rashid, do you have something to share? I saw you.
I had a brief comment on kind of the taxonomy of investments, but I think there's actually been quite a lot of sharing of links and relevant taxonomies already. I don't want to, I mean, it's kind of ironic to be duplicating in that space when we're talking about avoiding duplication. But I guess it's a sign that we are on the right track, right? Once you are able to map out the areas of investment and then make it clear where the foundations are being developed. And as Jay said, like, I mean, once those foundations are there, it keeps developing further and further. So yeah, there's a lot of already good input here, so I don't want to change the steer.
I think that's a good point, and also talks to the ambitions within this dialogue, but also ambitions within the roadmap. Because the point I think is worth emphasizing is that we need to think of the alignment actions, so the partner and donor alignment actions, from the global perspective. What do we need to do? And the discussion you were talking to around taxonomies is an important bit for those of us with a normative role and normative mandate, and those who are tasked with ensuring that the normative role and the mandates are then transferred within the countries. So linked to the point that Ajay was making around enterprise architecture and those components in the country. But then also within the national level, there's the alignment from the financing perspective and what needs to be financed. But that should be informed by aligning on what needs to be developed, what needs to be in place. I'm almost a lone voice, but I know there's so many on the call that agree with me in terms of alignment action at the subnational and service delivery level, in terms of some of the actions we can take, because for as long as we either parachute within the communities and introduce initiatives and innovations, even when there's a pretense of alignment at national level, then there may be a challenge. Because remember that we need to have, why are we aligning? Why are we working together? I think Lizzie has her hand up.
Yeah, thanks, Brendan. I think mine also kind of fits into what you're saying, and I've seen that back here in Kenya. It's like after Trump's decision with PEPFAR and USAID, the government has decided that any sort of project or program that's being implemented at a community level has to be aligned with the national directives. So if it doesn't feed into the overall agenda of the government, they will not allow you to implement. And I think that's a very cool move in regards to absorbing programs, right? If the funding comes to a stop, then there's a way it could be integrated to the national programs, which is something that I would say it's a kudos to this new government. I just needed to add that as we proceed. Thank you.
Thanks, Lizzie. And you also so I also worked in Kenya previously with WHO, and in one of the assessments we did in terms of cross-programmatic efficiencies, we found that in one county, there were around 20 EMRs, 20 different EMRs in one county. So the county in Kenya is the subnational level. So you could imagine all the investments and the efforts towards the different pieces and how much efficiencies or monies would have been saved if you had aligned on just one EMI and scale it within the county. Because even those 20, it's not that the whole county was covered. It's just pieces and pieces in different facilities. So I think I like to emphasize that bit in terms of action. If I go back to the board, I think before I hand back, there's a lot of all funding agreements and memoranda. Sorry, I think you've moved the screen to the previous ambition. Should reference national digital strategies. So that's the normative part. Harmonize programs to reduce duplication, both from design and implementation. National coordination takes money and technical capacities should be considered a critical area for investment. So I do agree. So alignment and coordination. And if I dare add, because that's one of the words we're throwing around now with the EdCats integration, is not cheap. So even saying we need to coordinate ourselves better and the processes we're talking about earlier of having either normative approaches to how we organize, so the coordination groups, the working groups, the tools they develop, the strategies, the concept strategies, all that needs a bit of investment. And if you don't invest in that, then you may not benefit from the gains that accrue from having a better alliance system. So I think I see a lot of coordination, which I know is good and is what essentially the word alignment means. But duplication is not being addressed by some of the things I'm seeing. And the duplication, as I was saying, happens especially within the context of implementation. There's a good point around work in tandem with the hardware, software partners. Again, in most of our countries and your countries, you find even when there's especially where there's no agreed approach to doing things, you'll find many bits of hardware, many bits of software that may not be easily updated, or when the licenses are expensive to update compared to what the countries can afford. So there's very many bits and pieces that would align on if you have these tools and structures to align. Tariro, you could come in.
Thank you so much. I'm Tariro from Zimbabwe. I think I go with the issues of national strategic plan. As civil society and communities, we fight a lot at funding levels, like when we're writing global funds, whatever, paper, whosoever funding and so forth. But where we should put our energy and fighting is at national strategic planning, to see that all our issues are in the national strategic plan. If they are not in the strategic plan, no matter what, integration, or even if we are coordinated, we won't win. Even the funders also, they look on national strategic plan. So I just urge my fellow civil society and communities, let's be on the table when strategic plans are reviewed, when strategic plans are being developed and so forth. And that's where we should fight more, not at level when we. Yes, thank you.
Thanks very much, Tariro, and thanks, colleagues, for inputting into this session. I know we are almost running out of time, so I'll hand over back to Christina for the next session. I know that different bits are interlinked, so I know whatever we're missing here, we can also bring it on in the next session. Back to you, Christina.
Thanks, Brendan. I think though that we might actually not. I mean, unless we keep this very, very short to about 4 or 5 minutes tops, that we just talk to the last ambition very quickly, because then we'll want to kind of bring it to a close and kind of wrap it up. So Rishabh, I know that's a very tight turnaround for you. If we can keep this discussion to 4 or 5 minutes tops, and then we'll finish it off. It's the last board to the right, everyone. I don't have control of the board. Someone else has it, so I can't bring you over. But if you scroll over to the right on the app, the Miro app, you'll find us here with the pink post-it notes, sticky notes. So Rishabh, over to you, 4 or 5 minutes tops, and then we'll do final thoughts, close.
Sure, thanks. I know everyone is very eager to be contributing the last 10 minutes of a long session, but I find this personally very interesting. So transparent mechanisms to track and report on digital health investments. And is this the right ambition, and is this achievable, I guess, is a big question. And will it contribute to more sustained investment for UHC? I'm seeing integrate DH and UHC monitoring. Cuts. I also do want to ask, because I think I have an answer to this myself, but is this ambition missing anything? And in my experience with, as an economist with digital health investments, I do wonder if we can update this to transparent mechanisms to track, report, and evaluate digital health investments, because I think just tracking investments without understanding if they're being used appropriately and if they're delivering the value is going to, one, I think, change the appetite for investors, but also we should be able to ensure that these are supporting our path to UHC 2030. I see integrating the existing mechanism of tracking, integrate DH into assuming national health accounts and OECD reporting. MEL, perhaps have standardized reporting frameworks. Very important the correct metrics are used to track and report on DHI and UHC. So I'm getting a lot of signs that it is very important, which is great. I guess there's one more small one. Should capture the evidence actions in the loop to ensure its use. Yes, that falls very much into the bucket of evaluation that I was hoping to incorporate into this ambition.
Michelle, do you
Yeah.
think the ambition is transparent mechanisms to track, report, and evaluate. Do you feel that the current mechanisms are transparent enough? And what would make them more transparent? And what would it involve from people to push for that?
I do not think they're as transparent as they could be. I think one of the issues is the lack of a coordinated or consistent kind of digital health expenditure framework. I think if there is a common set of understanding of these investments, which actually kind of ties back to the taxonomy in a little bit in some ways, then that would kind of help in that transparency. I think transparency goes hand in hand with understanding where we map these components of these investments together, and that comes with some type of framework. Review. Yeah, I mean, I don't want to go over time. I know we only have 5 minutes left to reflect, and there's already been a lot of helpful sticky notes, I think, in the Miro board.
The quick question from me. So as we consider transparent mechanisms to track, report, and evaluate, we seem to be at the other end of the pipeline. In order to do that, wouldn't we also require a process of participation at the front end during the planning and during the development and planning process in order for civil society, for example, and other actors to know exactly what is being tracked, how the decisions to prioritize certain solutions are being arrived at, and then how can we can track that. I just wondered if you had some thoughts and reflections on that.
Yeah, I mean, so are you saying kind of more engagement at the kind of community local level of implementation to ensure that there is capacity for tracking, or is it more I guess we could get some clarity in kind of what level of the transparency? I think that's for. Is that what it is? Is it kind of community civil society level of?
I'm just wondering if we, I mean, there's different reasons to track and different purposes. There's a political, there's a kind of technical, there's a kind of economic reason to track all of this. And I'm just wondering if we also want to consider or think about the different actors that will be tracking and their process of engagement in developing the plans that they will then be responsible for tracking. I'm thinking of in the early 2000s, we had the poverty reduction strategy papers that were developed. I mean, I know they were full of problems with them. They were just papers, but they required a process of engagement and participation of multi-sectors and civil society in particular. And the accountability frameworks were potentially stronger. Certainly, I was at Oxfam at the time, and it enabled us to track government performance more effectively.
Yeah, definitely. I mean, yeah, that's pretty fair. I think if you're not really capturing the level of engagement in the implementation itself, you might just be siloing these investments, and they won't actually be kind of long-term sustainable. So, and I guess it's elements to track beyond the investments themselves, right? It's the implementation, the framework. I'm hoping that goes with the evaluation, but that is post investment, which is not always the best time to be ensuring that it captures all these elements. I did, there was, I mean, I don't want to toot our own horn because I think there's a lot of other taxonomies that have been helpful, but the OECD and the GDHP, which is the Global Digital Health Partnership, developed a policy checklist, which is essentially 24 areas of health data governance and digital health implementation to kind of consider. That ranges from human factors to infrastructure to interoperability and standards. And as we were talking about the taxonomy, these investments, and understanding that we don't duplicate and we understand how to make them transparent and how to actually manage where they are putting money into, I'm wondering if these taxonomies can be used in the same way to really understand the policy deliverables that these investments bring. and understand where in these frameworks they hope to deliver that and in what way, not just the financial scope, but also the kind of the aim deliverables across the specifics of health data governance and digital health implementation. So we understand kind of where these grants are headed towards, and then obviously use that to kind of build an evaluation framework. But yeah, Frank, I don't want to keep rambling. I know we're almost out of time, and I know there's a lot of useful comments that could be piling in. So I guess I can hand it back to you this time.
Fantastic. Well, listen, thank you so much. We're at the top of the hour. So we've come full circle. We've filled 2 hours. It seemed to go very fast, at least from my perspective. I've got RSI from trying to capture so many notes and transferring them across. So I want to thank everybody for participating in this dialogue. I want to thank the co-hosts for their leadership in this initiative. We will be consolidating all these reflections. Please don't feel that you've missed an opportunity to comment or to share your thoughts. There will be another opportunity with the dialogues, with the process of broader participation and consultation that we're going to be opening next week. So look out for that. I just want to take this opportunity to, again, thank you all, invite you to participate in the other dialogues. I've noticed some of the names in the list of participants were here yesterday and some the day before, so it's great to see. These dialogues are taking place every day during Digital Health Week. Thanks, Christiana, for sharing the list of these in the chat. The list of tomorrow's dialogue on leadership and management. And then on Friday, we will be looking at infrastructure standards and interoperability. All these issues are interconnected, and we will be trying to sort of look at some of these interconnections as we build out the roadmap. Okay, with that, I don't want to take up any more time. Thank you so much to the co-host for leading this initiative, and to all of you for participating. Have a lovely rest of the day.
Thank you.
Thank you, everyone. Thanks, Kristen. Bye, everyone.
Bye, everyone.
Bye.